Dr. Erika, what is hormone replacement therapy? Is it good? Is it bad? Who should take it and who shouldn't?
Well, you're asking me, and I've been working with hormones for the past 30 years. So you know what I'm going to say to you. Um, Hormone, it's first of all, it shouldn't be replacement therapy because it should just be supplementation to help balance your hormones. So whether you're a teenager with acne or you have a baby, right? Or you need to figure out how to have a baby, you're looking for fertility answers, or you have a baby, or you're premenopausal, or you're menopausal, hormones determine if you're healthy or not. So the question is really not should you be on hormones, but rather what is the right combination, what makes sense for you, and to realize that hormone therapy may very well be the answer to a lot of the questions that you've had, that you've gone to a thousand specialists for, but never got the answers. So now, like you said before, that there are a lot of experts and it's a big area of conversation. And if you go on social media, you have all these experts in hormones and in longevity and things like that, but they don't really see patients. And the thing is, I've been seeing patients for 30 years and I still see them. And so I've learned a lot. I learn everything I know from my patients, actually, and obviously from the science, but the science only works so far. It works as far as it applies to the individual patient sitting in front of you. So the long answer to your question is, yeah, hormone therapy is great. It's absolutely wonderful. And when you're talking about hormone therapy, I'm not talking about bodybuilding hormones. I'm not talking about anabolic steroids. I'm talking about the hormones that were missing or are out of balance. And I'm talking about thyroid. I'm talking about adrenal. I'm talking about estrogen, progesterone, testosterone. I'm talking about hormones that constantly move in your system. And if they're in balance, you feel great. If they're not in balance, you don't feel so great.
That's interesting because, as you said, that's one of the reasons why I wanted to have this conversation with you because we see a lot on social media, all of these experts, and they might be good on. I mean, they might be legit doctors on their field, but they might not see patients. One, and second of all, one thing that I've seen lately is doctors contradicting each other. So
Yeah.
the general public is confused. It's like, who should I believe? What should I do? And you having 30 year experience, which you don't look like. I mean, it's like it is incredible. But besides that, it feels like we want to have more clarity in this. And you mentioned when we don't have the balance in our body, we don't feel great. What would be those symptoms that some people, and I know that it would be different between men and women, that we could feel that might give us a sign that we might need some hormone therapy?
Well, I think depending on your age, and like you said, depending on your gender, um, there are different symptoms. But I think like things like you won't think about right off the bat. You'd be like, how about just being tired, not sleeping well, gaining weight or losing weight, even though you haven't changed anything? Um, when you talk about more advanced issues, you're talking about like women with night sweats, hot flashes, insomnia, recurrent urinary tract infections. But that's kind of people are starting to get it. The doctors are starting to get it. To start looking at hormones by the time it gets to that. But like if you're talking about a teenager with acne or headaches, uh, that definitely should be hormones to look at. But keep in mind that everything works together. There's one of us. Each one of us is unique, and our everything in our bodies works together. So you have to keep in mind that since they work together, everything's connected. So whether you're eating well or not will affect your hormone balance. If you're sleeping well, if you're exercising, you know, if your stress is getting to you, all of these things affect your hormones.
I can see that. Now, the question would be probably is, as you mentioned, if we have a bad diet, we will experience some hormone disbalance, or if we don't sleep well, or if we're stressed. But
Right.
my question would be, if we take those pills or those treatments to bring those levels back to normal, but we don't change our behavior, does it have a not ideal outcome? Because at the end of the day, I guess I would assume, I would think, and comes from a very ignorant standpoint, that if we change our behaviors, if we start eating healthier, if we sleep more, if we regulate our level of stress, those hormonal levels might get back to as close to normal as possible. We must still need some treatment, but what happens to those people who get dependent on the treatment without changing their behavior?
Well, the treatment is not going to last very long. The results of the treatment won't last very long. The thing is that unless you change your behavior at different ages, you could do different things. Like your diet cannot be the same when you're 30 or when you're 60 or 70. You know what I mean? It just doesn't work, And the first thing that I can think of is alcohol, right? So while at 30, your body will detoxify the alcohol and take care of you and you'll be fine after 24 hours, at 70, it's not going to happen. It'll just stay there. It'll just kill your liver. Your liver is already toxic. So you're not going to do well. And so it depends what your age is and depends what you're doing. The same thing with sleep. Like, when you're in your 20s, you can sleep 2 hours or even skip a night and you'll recover. You can make up for lost sleep. When you get older, you can't make up for lost sleep. Even if you sleep 12 hours, which you can't as you get older, um, you still can't make up for it. And your body's not going to recover as well. So there are things that somehow we don't want to hear and we don't want to understand. But it's really important to realize that you can't do the same thing throughout life. When you're young, you can get away with a lot more than when you're older. But most people just kind of give up and say, okay, I'm old, that's it. And that's their prerogative. Or they can say, well, I'm going to change my diet as I get older to support my hormone balance, to support my well being, to prevent disease. I mean, you know, in the conventional system, which is where I come from because that's where I was trained, but I've been out of it for a long time. So, in the conventional system, you're trained to just, if you're a gastroenterologist, you just look at stomach and intestines and that's it. And I can tell you that as recently as 10 years ago, and probably to this day, you'll find gastroenterologists who will not see or tell you that you have to change your diet, that your diet affects what's going on. Most of your hormones are made in the gut. And if they're made in the gut, what your gut microbiome looks like, the bacteria that live there, affect how you absorb hormones, how you make hormones, how your body functions. So your wellness is directly tied into what you're eating. Well, as I said to you, 10 years ago, gastroenterologists wouldn't even tell you should take a probiotic. And they never told you that your diet has anything to do with the fact that you have GI problems. So in the conventional world, it's very difficult to change a way of thinking.
That
It's changing. It's changing, but it'll take another few decades.
that actually just blew my mind, because if you had said to me,
Why?
if you had said to me that 40, 50 years ago gastroenterologists wouldn't even mention anything when it comes to diet, okay, i, I would understand. But 10 years ago, not even doing that, it was like, you are the gut doctor, you're supposed to not only know this, but inform your patients. Whether they want to follow your advice or not, that's a different story.
Of
But
course.
you need to tell them, hey, you need to change your diet, because that's your entire health depends on what you put in. And not doing it 10 years ago, that just blew my mind. But another thing that you mentioned about drinking at the age of 20 or the age of 70 or sleeping at the age of 30 and so on, that at some point in your life we need to prevent, we want to have behaviors to prevent it, diseases. And you're one of the few people I've come across that is huge into preventive medicine. So why should we start practicing preventive medicine, and why isn't this a common trend?
Why it hasn't become a trend? Actually, I think it's starting to. I mean, at least in my practice, and I still see patients, every week. In my practice, people only want to prevent disease. Um, why would you want to prevent disease? Because I think you want to enjoy your life. And life, you don't know how long or how short it is, but you might want to be the best version of yourself and live an optimal life. I think that unfortunately, American society is more about making money than it is about helping the public optimize their life and understand what works versus what doesn't work.
Yeah, when we were talking off camera, we mentioned, and I'm glad you brought into the conversation, is, yeah, it's a lot about making money. It's a lot of, pumping pills that is like a lot more profitable than preventive. They start taking action to prevent medicine. But one thing that I was one thing that I thought about is like, you doctors know risks, right? What are the side effects of a new drug? What are the complications in a surgery? So on and so forth. But I think that both doctors and humans, we don't, or just people in general, I would say, we don't think too much about the risk of inaction, of doing nothing, right? And I feel that what I've talked to other doctors in the past, at least in this country, when they talk about a risk, they only talk about a 10-year span. They don't talk about it like, well, what's going to happen in the next 10 years, no, what's going to happen in the next 40 or 50. So somebody like me who's 30, right? I found myself a few times in my life like, well, I'll cross that bridge when I get there, right? But
Mhm.
how early should we worry about our health? Because it is hard to find the motivation, because there are no reminders at an early age of our own mortality.
Well, I try to remind everybody. I've been doing it for 30 years. It's just like, how many people could I reach? How many people can we reach? I think, um, there was a book that was written about on being mortal. And that was a great book. And I can't remember. I mean, he's a very famous author. Um, my God. And the book didn't do as well as it should have done. And it was there was a documentary on it. And his name is, oh my God, on being mortal. Here it is. Um, Atul Gawande is his name. And it was an amazing, he grew up in India and he wrote about how he's a top physician. I mean, he's an MD too. And he wrote about, we're all mortal and how mortality is part of life in India and how getting older and the whole society is geared towards respect towards the aged, and looking, as death as part of life. Somehow in America, that book didn't do as well as it should have. I thought it was a brilliant book. I think if we had learned something from it, it would have helped us a lot. But I think that, look, now we're focusing on longevity. We want to live 150 years, which is great. But the question is, how are you going to live that life? If you look at healthcare today in America, most monies is spent at the end of life, the last year of life. And that's by doing all kinds of surgeries, medications, all kinds of things, just, that's spending an enormous amount of money on keeping people alive. But the thing is, you can keep yourself alive by taking care of yourself, learning early on, spending the money on education early on, understanding that it is within your ability to improve and optimize your health so that the end of life should not be where all the money goes. And it shouldn't be a horrible end. It should be a really decent transition. That's what it should be.
Okay. That, what you just said right there, made me think about something. A lot of people, and I understand with inflation, cost of living is hard, right? It's hard to have a healthier lifestyle. Healthy foods tend to cost more, gym memberships, you name it. But what you said about that, the bulk of the money it is spent on our later years, getting treatments, getting surgery, getting all those kind of things. It's like, well, would you rather pay the bill at the beginning or you would rather pay the bill at the end? So spend a little bit of money now and prevent from spending a lot of money and quality of life really into your later years. Because again, we can live to 100, but what if our last 25 years were just we cannot get up from the couch or from the bed? Is that a life worth living? I don't know.
I don't think so. I don't want to be there. I want to be healthy, and I want to have a brain, and I want to be able to be a contributor and have a purpose until the day I die. But for some reason, I think I was lucky and fortunate, and I'm grateful for that, that I saw it early on, because I started by running a major trauma center because I did internal medicine and critical care, and realizing that some people we treated right and they died, and some people we did everything wrong and they walked out. So I realized that it wasn't all within our hands. That being of, like when you said physicians, doctors, and humans, you were like kind of separating them. Doctors are humans, and if they don't understand it, they're going to lose the game completely because they've lost the plot as it is. Because we're all humans, and unless we help each other and we share the information we learn, we won't we won't advance as a society. We won't make life better for the young if the old don't learn and share that information.
Yeah, that is one of the most fascinating and interesting things for me, and things that I still haven't found an answer for it. Because all the things you're saying to me sound like common sense, but as we know, common sense is not common at all. I could understand the regular people not knowing this. I could understand the regular people, society being highly ignorant, and I'm one of them when it comes to these topics, but doctors not pushing this agenda, or maybe doctors might not being aware of the importance of preventing diseases and start early on, whether it's through exercise, maybe hormone therapy, probably just like a more sleep or better diet. To me, it's like, what are we doing?
Good question. What are we doing? So it's up to you. It's in your hands to start changing it early. So my first book I wrote on hormones, The Hormone Solution, came out in 2002. And I looked at hormone balances at all ages. I started with teens, 20s, 30s, 40s, 50s. The book was very successful. And a lot of people have written the same book over and over again since then. So it's great that people have it raised awareness. So a lot of people have gotten the idea. Women, especially, are understanding more about it, but they're still taking birth control pills, thinking that they're the same as hormone replacement, which they're not. Birth control pills don't help. Birth control pills are okay to prevent pregnancy, but they're not okay to prevent sexually transmitted disease. They're not okay for the woman's body, but nobody seems to get that.
I'm
So there are a lot of things that could be different by now, but they're not.
I'm glad you brought out the pill because I wasn't aware of any side effects or bad things that could affect women's body until just recently when I started seeing more quote unquote experts or people that had more knowledge than me on social media, on the internet, explaining why the pill was harmful for women. And I'm glad that you brought it up because you, as a doctor and as a woman, I would like to ask you what are the side effects or how can the pill harm women's body in the long term?
Well, the pill is made out of synthetic hormones, so they're fake hormones. They're not real hormones. And what they do is they stop your own hormone production. And what they do is they keep women's hormone levels at menopausal hormone levels. So you think about that. What it does to the mood is one thing. I don't know. That's a horrible thing. But it increases the risk of disease. So women who are in their teens and 20s are operating at hormone levels that menopausal women operate at. So it increases the risk of, what we know about is blood clots, right? But that's an immediate risk and that can kill you immediately. Uh, but over the length of time, if you survive it, there are issues with fertility, there are issues with bone density, there are issues with cardiac disease. All of these things nobody talks about, and yet birth control pills are handed out like candy. And this is just one example of things.
Yeah, my you you made a quite a few points of why the pill is harmful, and if I were a woman, right, after listening to these kind of things, I wouldn't want that in my body. But I understand why it was created back in the 60s. I get it. But
No, it was created in the
I was
30s.
creating the
It was
seconds.
created, you know what? It's been around since the 30s and the 40s, and then in the 50s and 60s, it became more and more and more prevalent.
Okay.
So it's been around for a long time, but the interesting thing is that the research has never been done to see what the long-term side effects are. And I would wonder, why isn't the research there?
Oh, I guess it would be omission by design. Like, well, if we don't do the research, we don't have to, I mean, we can play ignorant and say, well, we didn't know. And
Right.
it just very, very sad and concerning. Honestly, I'm glad I don't have to go through it. But a lot of women probably take those thinking, oh, this is normal. Every other girl I know does it. And whether they are in a relationship or not, even when they're single and they still take it, it's like,
Yeah.
how many years are you taking? Like 10 years, 15 years until you get off the pill? And then what are the long-term side effects in your 40s or 50s or even 60s? It's very, very concerning. And I don't see many people speaking out about the possible damages that that could cause in women's hormones, women's body, in women's even mental health. I would assume.
Of course. You're right.
Yeah, that's. But it's well, hopefully more and more research can come out, and more
How
people.
about some research? Some
Some
research.
some research. True, true. Although I will say this is people will find what they believe and what they're looking for, right? There's always going to be a study, there's something going to be some information, whether it's accurate or not, that will tell you that birth control pills are safe. And then, okay, see, I found something. Is it accurate? I don't know. But the internet told me. So I can see how a lot of things that we talk about, even if we touch the topic on the male side, would be you see a lot of advertisement when it comes to testosterone, that a lot of men have low testosterone for various reasons. And I don't know if you talk if your patients are more female than male or just around a 50-50, but is it accurate or is it true that most men have low testosterone levels and we need to get more testosterone, or it's just like only a few of us might need it?
So the practice is 50-50, men and women. But it started out with mostly women. And then over time, which is to me a sign of evolution and that men are becoming aware of it. It now is 50-50. So, there is, and there have been a lot of stuff written about it, that more men have low testosterone levels than maybe 20 years ago, 30 years ago. One of the reasons may be that we're testing them more, so we know more. Another reason would be that a lot of people, smoke a lot of weed, and that lowers testosterone level. And another reason is probably from the diet that we have that brings down the testosterone levels. The interesting thing is that when we think of testosterone, we associate it with, libido, sexuality, right? But it turns out that I've seen many, many men with very low testosterone level who had no problem with libido. So what that raises in my mind is, what's the connection? So I don't know that that's the connection that I really need to make or that we need to make, but rather the muscle mass. Testosterone helps you build muscle. Muscle is the currency of youth. So if you're young and you have testosterone, you'll be great. You can build your muscle. If you're old and you have testosterone and you're working out, you could stay young, basically. So testosterone serves a really important reason, a purpose, a really important purpose. So I think that it would be nice if men had their testosterone levels tested when they're very young, before there's any problem, because that would give you a baseline so you would know where you're starting from. Because then you would have more information, like maybe at normal, regular testosterone levels, 200. Maybe it's not 800. Do you know what I mean? We don't know. And as you know, we know that everybody's an individual, so it would be nice if the doctor, the pediatrician or whoever is doing the testing would think of doing baseline testosterone testing for men.
How old should the person be, or how early in his life should he be to start testing for testosterone levels?
Um, I would say like 18 would be a good time. 20 would be a great time to have a baseline testosterone to know where you started from. I mean, I saw, I could think of somebody, patient who was in his early 20s who came in with low testosterone level. And I didn't know what it was before, but it turns out he was, like I said, he was smoking a lot of weed. So when we told him to stop smoking and he actually listened and he stopped smoking, his testosterone levels came up. So I didn't have to give him supplemental testosterone. He just understood the connection.
Yeah, I'm glad that it could be fixed relatively easy, and it's a good thing that you mentioned, because I've heard some doctors, experts online, that said that many guys don't need testosterone pills if they just sleep more, exercise, and have a better diet. They can raise their testosterone levels. I would. I want to think that that is accurate, because that person is not pushing an agenda of you need pills or you need to take this. So again, is there any reason why even a man doing that could still have low testosterone levels?
Well, if they're doing all of that, if they're adjusting their diet, if they're exercising, and they see they're not building muscle, they might, if they're sleeping well, if they're dealing with stress, if they're doing all of that, and the testosterone level doesn't go up, then there might be a reason to give them testosterone. But I don't think everybody needs testosterone the same way. I think that there's a lot you could do to improve your hormone balance through diet, exercise, stress management, sleep, lifestyle in general, you know?
Yeah, yeah. I guess I mean, I've never done. I've never tested my testosterone levels. I think I should do it.
You should.
Even though, yeah,
Right.
I guess I don't know. I Part of me feels, because I eat relatively healthy. I exercise 7 days a week, and I try to sleep between 7 and 8 hours every night. So to me, it's like, do I need it? Well, it would be good to know whether if I'm okay or not. Or as you said, now that I'm healthy, or that I have a healthy lifestyle, I can sort of know a baseline and see in the future. Even though I'm kind of older, I'm not in my early 20s. I'm in my early 30s, but it's still, my body's still pretty healthy, and probably that would be the case. I think I'm thinking about doing just soon, because I've only heard about this in the last 6 months, a year. Before, I was not aware of guys needing testosterone and changing diets, or even taking pills. So I'm glad it's brought up, but for the wrong reasons. I think that it has brought up because of trying to sell pills, but at the same time, it creates awareness and knowledge among men to know I might need to change my lifestyle, or I might need to take something to enhance my quality of life. So now that we talk about diet and exercise, that reminded me of, and we talk off camera, of this magic pill, right? Called Ozempic. I call it magic because it seems like it works wonders for a lot of people. Even though this pill was created for just treating diabetes, what can you tell me about it? Is it good for people? And do we know at this point, even though it's early on, any side effects down the road?
Sure. Happy to. So Ozempic is a peptide. It's not a drug. I mean, the pharmaceutical companies obtained FDA approval, but it's a peptide. And a peptide is a small protein that your body makes. So it's the same as your hormones. Your body makes it. It's not like a drug that comes in and is made in a lab only. It's a peptide. So your body makes peptides. And when this particular peptide, which is called a glucagon-like peptide 1 agonist, what it does is it affects the way insulin and sugar interact in your body. So it got FDA approval initially for diabetes. And it's a great, it's amazing, it's wonderful. Then it got FDA approval for obesity, which I think is great too, if done properly under the supervision of someone who actually knows what they're talking about, because it's obesity that's killing all of America. So you don't have to get to diabetes. I mean, once you're obese, you're doomed. So you have to change your diet, change everything. But you know what? If you can have some help, the peptide can help. So Ozempic is great. And then it also got FDA approval for cardiovascular support. So it's a great peptide. But this is the problem. The problem is, like everything else, because we're Americans and we think in terms of a cure all and a pill to save, to take care of everything, because we don't want to do any of the work. We basically have now, we're abusing Ozempic, Mounjaro, all of these peptides that have FDA approval. And the reason we abuse them is because we think now, okay, now I can be as skinny as I want to be and I can eat whatever I want to and drink whatever I want to. Well, but that's not the way it works, unfortunately. Unfortunately, if you drink alcohol with Ozempic and Mounjaro and any of these peptides, you actually endanger your liver even more and you get pancreatitis, you get a lot of problems. So the fact that you could get them online is obscene as far as I'm concerned. And it's like, it brings me to our conversation that we had about advertising, pharmaceutical advertising to the public, which occurred in 1997 in the United States. And it changed everything because now the public can go in to the doctor or whatever, whoever the provider is, and say, this is what I want. And it's not only that, it's that you can, since COVID, you can go online and just get anything you want. And you can have a telemedicine call, which with a non-doctor, with a whoever who doesn't know you and will prescribe anything from Viagra to Ozempic. It doesn't matter, because people don't care about human beings; they care about money. And unfortunately, whenever you care about money rather than human beings, it's not going to lead to anything good. So anyway, so Ozempic, as far as I'm concerned, we use it in the practice. We used it before it was FDA approved because we've been working with peptides for almost a decade. And we know how to do it, but we do it because in a way that we follow our patients, we talk to them pretty much every week, every other week. We also make sure that their hormones are in balance. We also make sure that their diet is the right diet. They exercise, the sleep, the stress management. We put the things together for them and we kind of quarterback their health. So in our practice, we've never had a patient who had any significant side effects. But in the people that go and buy it from, local whatever pharmacy on a prescription written by an AI, I have to tell you, I would not be so keen on doing it because I would worry about side effects that I know could happen if everything else is not put in place.
Yeah, I feel like a lot of people would do anything but exercise and eat well. It's just like anything you would and as you said, you need to put the work and you need to just do it. But what, since you mentioned about the insulin and sugar levels and how it was initially approved by the FDA for diabetes, how does it what it, how does this peptide help people lose weight? What happens inside an obese person body that helps that person to get in a healthier weight?
Well, this particular peptide, which I said it's called glucagon-like peptide, um, what it does is it helps your body process sugar differently. It releases insulin differently, and it works on your brain essentially. It also works on habits. Like if you bite your nails, this will help you not bite your nails. So it's a very complex, beautiful way in which the glucagon like GLP-1 agonists work. Um, I think that, it slows down digestion and it slows down the way things come out of your stomach. Food gets digested. So that's where a side effect can occur because it can kind of stop. It's called gastric paresis, which means stops your stomach from emptying out. But that's why you have to know what you're doing. Um, so that's one of the ways, but it's a lot more complex and it affects a lot more than just the gastric emptying. And it cuts your appetite, so you're not hungry anymore. It does a lot of really beautiful things, but it also gives you nausea. It also makes you sick if you're not doing it right.
Yeah, and I'm glad you brought that up because that's one of my issues with this peptide, right? When people can get it anywhere online without a a doctor who cares like yourself, then it's not really those people are not really changing any kind of behavior. So sure, you will eat less, but you will still eat the same crappy food and not exercise. So, and everything has a cost. As you said, you can have nausea and you cannot feel well because you still have your same diet, hoping that you can keep your lifestyle and just adding this peptide to your lifestyle,
Right.
you can just, change. And we clearly know that's not the case. And people should be more aware before even diving into that. But my understanding is like it helps more for people who are very obese, and it has very little effect from people who might be, I don't know, like 10 pounds heavier or 15 pounds heavier. It's like it works more with extreme cases. Is that correct?
Yeah, the data says that, but I find it in my practice that if somebody wants to lose 10 pounds and their hormones are imbalanced and they're following our diet, exercise, lifestyle support programs, I will give it to them for a couple of weeks. There are people who'll do it like, they'll have to go to an event. It's a great, you know what it is? It's a great tool in our toolbox. But the thing is, you don't need to use all the tools in your toolbox all the time.
That's fair. That's
And not one tool will ever work for everything. You know that.
Yeah, and I wish more people knew that. I wish more people knew that. People feel like, okay, this is what I need to take, and it might be, as you said, it might work for you for a couple of weeks, maybe a couple of months, maybe a year, but after that, is it still working? Probably not. Probably not. And since we're in the topic of dieting specifically, I like to talk about two things that again are very trending on social media nowadays. One is metabolic the metabolic rate and intermittent fasting. Now, what is a metabolic rate for those who don't know, and how intermittent fasting can affect this?
So metabolic rate is actually the amount of calories you have to burn to maintain your weight. That's all it means. And we measure it on every patient because we have this piece of equipment which looks like a like scale, but it's actually a computer. So you get on it and it tells you what your metabolic rate is, what the percent body fat is, how much muscle you have, how much fat, how much water, how much visceral fat, the fat on top of your organs. So that gives us really a lot of information. And it's obviously, it's done just the part of the vital signs. So it's great. So the intermittent fasting is been a very big um, diet for many years actually, and it's got all kinds of variations on it. But what it does is it keeps the amount of time that you do eat very small, as much as small as possible. So let's say you stop eating at 7 p.m. and you don't start eating the next day, because it's great to fast at night because you're sleeping, hopefully. and, and you start the next day eating at 2 o'clock in the afternoon. So this way you have 5 hours that you're eating out of 24 hours. And that's actually an interesting way of getting people to lose weight. And there's an enormous amount of data. And as you get older, the less you eat, the better it is. It's the only thing that's associated and has been connected to increased longevity, which is not eating as much, bringing down the amount of food that we eat and how much time we spend eating during the day. So that's what intermittent fasting really is. It's as simple as that. When you skipped breakfast and your first meal is lunch, you're intermittent fasting unless you keep on eating till midnight or 2 o'clock in the morning. So um, you can't intermittent fast by having breakfast and then not eating anything till dinner. You already destroyed the intermittent fasting when you had the breakfast. So there are all kinds of ways. Then the other thing is there are ways in which you fast for a whole day. You just drink water and you do it every few days, like once a week or once a month, or there are a lot of variations on the theme. The idea is to try to detoxify your system, allow your liver to cleanse itself, to get rid of some of the 4,000 drugs everybody takes, and because they get clean through the liver, and to give your body a chance to recuperate from all the insults that we're giving it all day long. So, the interesting thing is that intermittent fasting may or may not work on people, like everything else. It can also work for some time and not all the time. Like people will go and do very well with eating, 7 hours a day, which would be great. And then all of a sudden they start getting hungry in the morning, and you have to listen to your body. And that's one thing we teach our patients. Listen to your body. If your body is hungry in the morning, intermittent fasting is not for you. So then what you eat in the morning is really important. And then you go to what we really need is protein and non-animal fat, like avocados, olive oil, olives. And, you know, we also need carbs because your brain needs ketones and needs carbs. So you want to make sure that you do it in an intelligent way and you don't just eat processed food. It's all about processed versus non-processed food. So when you look at the label, and that if that alone would be something people would learn to do, is to read the label on anything you buy. And if it says it has anything you can't pronounce in there, don't buy it. And don't put it in your body. Your body has to get rid of it.
Oh, I can see that. And to me, it's always been fascinating how many people are into this new trending. We'll say new trending. It's like it's becoming trending nowadays. I know there's been like a very old way of dieting, just doing this intermittent fasting. And I know that every person and every body is different. Me, it's just I can only quote unquote fast for 10 hours. Those 10 hours are the ones that I'm in bed. But yeah, every morning I'm just starving. But where I, where I grew up, it was mostly we have a strong breakfast, a strong lunch, and a very light dinner. So
Perfect.
to me, every morning I eat like 3 eggs with avocado, chia seeds, like a slice of sourdough bread, cottage cheese, and fruit preserve, and that's my breakfast. Plus probably a banana or something. But
That's wonderful.
I feel like it's just well. First of all, I'm hungry all the time. But also I exercise. I mean, I run daily, so probably that's why. But it just, when you said that that could extend longevity, for some people that can only eat, let's say, 5 hours in a day, are we talking about the amount of food or the amount of calories they consume? Because,
Well, food and calories are kind of the same.
well, because
So,
because
yeah, no, it's the amount of food. Yeah, of course, it's the amount of food.
bec-
It's how much you eat. So as you get older, the less you eat. You can't eat as much as you used to eat when you were 30. And if you eat less, your body will do better because it'll have less to clean up.
yeah, because again, but I think that it still is kind. I feel that obviously there's a correlation, but also depends, because somebody, let's say the average human burns, the average healthy human burns 2,000 calories a day. Just for the sake of argument, I can eat donuts every single day, but those donuts would amount to, let's say, 1,800 calories. I would still lose weight. I'll be extremely unhealthy, but I will lose weight. But I could also eat chicken, rice, quinoa, vegetables, and all of that in a day, and consume 2,500 calories. I'm going to gain weight, but I'm going to be healthier.
Correct.
So I think people focus a lot too much on the calories and not the quality of the food that they consume.
Right, because you know what? Because all the diets that we hear about is about calories, cutting back on calories instead of looking at the quality of what we're eating. You're right. Totally right.
Yeah, it just, I try to have like a balance. Yeah, I mean, I do have a sweet tooth. I One afternoon I can eat a cookie or something, but I tried overall
Of course.
to eat healthy, because at the end of the day, if we keep a very strict diet or just a very strict way of eating, then it's not sustainable, and we might be very very unhappy, which was the purpose anyway.
No, and you want to be happy. You want
Yeah,
to be
yeah.
happy, and you're human. So we have to be able to do whatever, eat junk once in a while.
Yeah, yeah, exactly. And one thing that is massive, and you mentioned earlier, was alcohol. And alcohol is a huge thing in society. It is, in many cases, how people connect and socialize. But what are the alcohol effects that almost no one is talking about?
It kills you. That's all. It's toxic. It destroys your liver and your brain and every cell in your body. That's about it. Alcohol is really the worst thing we have right now.
Legal.
You know, now we're talking, and we're talking about sitting being the new, smoking equivalent. But I gotta tell you, we should talk about alcohol first
Yeah,
because with COVID, everybody just started drinking and they never stopped.
yeah. I've never been like a huge drinker, but a couple of years ago, I started running, and I stopped drinking because I would feel like crap the next day. E- But
Sure.
when it comes to training, even if I would drink like a couple of beers, let's say on Saturday night, and I'm running
Yeah.
on Sunday afternoon, I would feel dehydrated, especially in Austin, that is so 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 hot. And every now and so I'm always training for a race. So when I'm training on my training blocks, I'm not drinking at all. And after the race, I might drink a beer or two. One thing I realized, first of all, my tolerance levels went low, like very very low. But the second is like, it truly, even if I drink one beer or two, it truly affects my sleep. It just, I can fall asleep super quick, but my sleep cycle, I wake up several times at night. Is After
Right.
that, I can now, I spend like what, 8 months without drinking, just because even one completely screwed up my sleep.
You're right. Yeah, and you got it. You saw it.
Dr. Eric, has been a complete pleasure.
Yeah,
But as a closing question, what
sure.
would be the top five foods or maybe even supplements that most people should take or consume?
Hmm. Well, the top five foods, I would say protein. So chicken, fish, beans, tofu. Eat protein, eggs. Eat as many eggs as you can. Yolk, egg yolk, very important. Not There used to be like egg white only, and I don't know what that was about. But egg yolk is really important. So that would be one food. The second one, as I said to you, would be avocado, um, coconut oil, olive oil, olives, that, non-animal fat. And then the number three food would be some kind of carbohydrate that, and there are only two carbohydrates really, which is potato and rice. That's it. And, get rid of anything that is processed. Cut back on processed food. Desserts, eliminate desserts, eliminate, I'm not even saying eliminate fried foods. I'm saying get rid of that and get rid of alcohol and cut back on the caffeine. Don't drink caffeine afternoon. Um, you know, Drink a lot of water. Make sure you drink half your body weight in water, but not fizzy water, not soda. Make sure you drink flat, regular water. That'll be important. So that's where I would say food. Oh, that's it. That's what I would say about food. And then about supplements, I'll say vitamin C, vitamin D. Um, those two are really important. And then probiotics, have one probiotic and the digestive enzyme to take. And then there are a lot of other, fish oil. You can have omega 3, omega 9, there fatty 15. I mean, there are a lot of omegas, but don't have omega 6. Have omega 3, 9. Then what else can I tell you about diet? Magnesium. Make sure that you take magnesium. Magnesium citrate is great. Magnesium, chelated magnesium. At night before bed, that will help you relax better, and it'll also have your bowel movement in the morning. Um, what else can I tell you about supplements? I mean, I work with so many supplements. I'm just trying to think about it. N-acetylcysteine is a great supplement, NAC, which is great because it clears your lungs and it's an excellent
How
supplement.
about
But
B12?
there's
How about
B12. Yeah, if you're not eating enough protein, animal protein, by all means get a B complex and or get a B12 shot. And then there are other B1 and B2 that are really important. So they have the B complex. Also, make sure that what you get is not cheap, because cheap probably translates into doesn't get absorbed and doesn't do anything. And have your levels measured so you know that it's working, and get it from a credible source, not the one that's marketing it the most, but rather the one that actually has the longest track record.
perfect? Yeah, I mean, that was a great and amazing answer, all very detailed of what we should incorporate into our diet, both on foods and supplements. And Dr. Eric, has been a total pleasure and very, very insightful conversation. Where can people find you if they want to either work with you, buy one of your books?
Well, they can buy all my books on Amazon. They're there. They can find me on Instagram at Dr. Erika, Drerika Schwartz, Schwartz, or they can go to our website, which is ES Health, which is also on Instagram at ES Health, or online. And they can write to our offices. The phone number is 212-873-3420, and we'll be happy to help. On Instagram, we answer anybody's questions. So just send us questions.
Great. And listeners and whoever's watching also on YouTube will find all this information on the show notes and a description. And once again, Dr. Erica, thank you so much for your time, for the insightful conversation. It was a pleasure and honor talking to you.
Daniel, it was a pleasure meeting you. You're wonderful. Keep on doing the good work.
Thank,
Thank you.
thank you.